Hello, everyone, and welcome to today's webinar, Sustainability of a CPS Program Today, Tomorrow, and Years to Come. This presentation was originally created for the 2020 Lifesavers pre-conference session, which had to be canceled due to the coronavirus. The presenters worked extremely hard on their presentations, and the information was much too valuable not to share. I am Debbie Landowski, the Quality Assurance Specialist from Safe Kids Certification, and I am here to welcome the presenters. As a note, this webinar does not qualify for CEU since it does not include any new CPS technical content, but it can be applied towards your community education requirements. This topic idea originally came about because so many instructors and technicians have expressed concerns they are being asked to do more with less, wearing multiple hats and sought ways to keep their programs going without minimizing their services. Some programs have additionally been affected by budgetary restrictions, time constraints for earning CEUs affecting recertification, as well as staff reductions, and most recently, the effects on programs due to the coronavirus. Since the majority of the CPS keys are first responders, including police, fire, EMS, and hospital personnel. Our objectives will focus on data, communication, being creative, and succession planning. It is my pleasure to introduce our three presenters. Our first presenter will be Kevin Poor, a health educator for the State CPS Office of the South Carolina Department of Health and Environmental Control. And he previously was a local injury prevention program coordinator in Columbia, South Carolina for 5 years. Our second presenter will be Michelle Sterling, who is a senior wellness and safety specialist for St. Joseph's Children's Hospital and the Safe Kids Greater Tampa coordinator. Our final speaker will be Kelly Powell Evans, who is the Vice President of Community Services for Community Partners of South Florida, and previously the Program Manager for Safe Kids in Palm Beach County for nearly 19 years. So without any further ado, I'd like to kick things off welcoming our first presenter, Kevin Poor.
Good afternoon, everybody. My name is Kevin Poor. I'm from South Carolina, and I work with the South Carolina Department of Health and Environmental Control, which is where our CPS program is based. Today, I want to share with you a little bit of recent history about that program. All right, so we are a growing state with over 5.2 million people, and over 90% of the land area in South Carolina is considered to be rural. One of the most consistent challenges that we have is child passenger safety, or with our child passenger safety, is that we have a high number of volunteer fire departments and many law enforcement agencies that consist of only 2 or 3 officers. As far as child passenger safety goes, South Carolina has had a CPS program since 1995, and that program is currently housed at DHEC. So I do want to share a fun fact with you guys, and that is about the Angel Oak in Johns Island, South Carolina. So the Angel Oak is thought to be the oldest living thing in the United States east of the Mississippi River. And so if you have an opportunity to visit the Charleston area, make sure you go by and see the Angel Oak in Johns Island. It's really cool. I've been there myself. So. All right, so a little bit about the program that I work for. The state CPS program is funded through the South Carolina Department of Public Safety with those 402 grant funds. We've had more than 4,000 technicians that have gone through the program at some point or have been certified in our state at some point. Since March of 2004, there have been 345 certification classes in South Carolina, and more than 250 of those have taken place through our program at DHEC. That, of course, is an incredible amount of work done in our relatively small state. I do want to take a brief moment here and mention Ann Stone. She's my partner at DHEC. Ann has been teaching the CPS course in South Carolina since 2000 and has been the lead instructor for almost 250 courses by herself. Almost every technician in South Carolina was either taught by Ann or taught by someone who Ann trained. And so we can't really talk about the history of child passenger safety in South Carolina without kind of talking about Ann. All right, so the primary stakeholders for child passenger safety in South Carolina include the Department of Public Safety, DHEC, Safe Kids, and then there are many local fire department, law enforcement agencies, and healthcare entities. With the Safe Kids, there are 11 local Safe Kids coalitions covering 35 out of our 46 counties, and that's where a lot of the on-the-ground work is done with child passenger safety. In fact, I would say that's where the vast majority of our work is done, kind of through those coalitions. So this is a graph that kind of breaks down where most of our work is being done in South Carolina. So this is a look at the types of fitting stations that we have in South Carolina. As you can see, over half of our fitting stations are fire departments, and then that's followed by like medical facilities like hospitals and health departments, and then about 15% of our fitting stations in South Carolina are law enforcement. So this is one of the things that we track, kind of who our partners are, and that gives us an idea about who our partners are most likely to be in the future. Safe Kids in South Carolina. So this is kind of a map of the different coalitions in South Carolina. So this kind of gives you an idea. I'm sure it's similar in many states, but you've got some coalitions that are a single county, and then you've got some coalitions that cover multiple counties. And unfortunately, we do have a few counties right now that aren't covered by a Safe Kids coalition. And so one of the problems there is, how do we get some of that work done in that area, and who do we sort of move that work through and get those boots on the ground. So that offers some challenges as well. All right, so I want to take a minute and as we put on this slide, remember the Alamo. So in March 2008, I was coming back from my second stint at DHEC. I was running a local Safe Kids coalition in South Carolina. After only a few weeks of being back at DHEC, our program had the opportunity to attend Lifesavers in San Antonio. I got to hear a really good speaker, a great presentation. Dr. Michelle Macy from the University of Michigan gave this presentation that in many ways gave us a roadmap to become a smarter CPS program. My personal takeaway was that we needed to start finding as many pertinent ways as possible to measure ourselves. Through a few slides in her presentation, I was able to look through a window showing me what was going on with child passenger safety in the state of Michigan. We wanted to be able to do the same thing for the state of South Carolina, or something similar. Her program has such a large impact on us that I sometimes refer to our program as our time in our program as before San Antonio and after San Antonio. There was another kind of watershed moment that happened not too long after that, where we had a representative from Safe Kids actually come and participate in one of our certification classes. And so that class happened to be held in Union County in South Carolina, and sort of shined a light on some things that we need to be changing in our program. And so kind of along those same lines, I refer to time as before Union and after Union. We'll get into that a little bit more in a few slides, but for now, we can just say that Safe Kids called basically many opportunities for improvement to our attention. So after San Antonio, we came back to the state and we reviewed our vision for child passenger safety in South Carolina. We added becoming more coordinated and transparent to kind of our vision, which includes to a large degree taking advantage of some local resources that we had in our state that could give us a broader best practice perspective. The second thing we added to our vision was to make a shift towards becoming more data informed. Okay, so when we started looking at what we were doing and taking the time to actually measure what we were doing, we started realizing that we were running way too fast, and we really didn't have enough direction about where we were running. Sure, we were getting a lot done. Statewide, we were conducting almost 22 classes per year. We had trained, as I said earlier, over 3,500 technicians since March 2004. But what we really needed to do was slow down and look deeper at what we were doing and why. When we started looking more closely at the work that we were doing, this is what we found. So after San Antonio, we realized how little we knew about child passenger safety in our state. We were virtually flying blind, and so were many of our partners. This includes Safe Kids Coalition. We, meaning our program, had no idea what local coalitions were doing in terms of seat check events, their contact with local partners, the total number of seats being checked in the state, education being given. We didn't have a system for letting local coalitions know we were going to be having tech trainings in the area. So if the Safe Kids coordinator, the local coordinator, was the one requesting a class, or if they had accidentally heard of it kind of through their grapevine, they may know that there was a certification class going on in their area, but other than that, generally speaking, they had no idea when classes were taking place. We were training tons of new technicians, but these technicians at the end of the day had no idea how to plug in because we weren't taking the time to introduce them to their local Safe Kids coordinators. So one of the other things is that there were at least 3 different inspection station lists being used around the state. And one of the big problems with that is that none of these lists matched each other. I personally was amazed to find out that there were inspection stations working with Safe Kids Coalition that our program knew nothing about. We also realized we were working with inspection stations that our Safe Kids partners knew nothing about. We began to realize that our office and local coalitions were at times even undermining each other. Due to a lack of communication and transparency, some local agencies were playing our office against their own local Safe Kids Coalition and vice versa, sort of in this mommy against daddy dynamic, just kind of using us to get, things that they wanted and not necessarily going through the correct channels. We had zero data on how many parents were being reached. Lots of generic forms were being used, and despite our training, in some cases, no documentation was being done at all. I'm very aware that seat check data has been available to local coalitions, but quite frankly, a few of our local coalitions needed to have that data force-fed to them. Many were turning in official forms, but were blissfully unaware that the data showed up on the other side of the system at some point. Coalitions definitely had no point of reference for how they stacked up against their neighbors and neighboring counties. We had about 1,200 techs at that time, and our median tech in terms of experience had been certified for less than 1 cycle. So basically what we did is we lined up all of our techs on a spreadsheet from the least experienced to the most experienced, and we found out our median tech had not even gone through the recertification cycle, not once. So less than 2 years of experience for our median tech. That spoke directly to the fact that we were working too hard for too little long-term results. Sometimes you have a sense for where you are with things, and sometimes you need to see them on paper. Seeing how many extremely small classes we were conducting actually on paper was very eye-opening. We took a lot of pride in our large number of techs, but unfortunately we're probably ignoring recertification rates too much. When I tell you our program was working hard, I mean that we were working really hard. We were conducting over 20 certification classes per year, but most of those people were flying right back out the revolving door in 2 years. That was not working smart. I think we needed to see it on paper just to really understand exactly how bad it was. And so that's one of the things that we did when we started putting this data together. We could see on paper, like, how we were really not using our energy kind of the best way that we possibly could. All right, so the next thing I want to talk about is improving coordination and transparency. So before we get into our improvements, I want to mention that we are well aware that our program is not yet on the cutting edge with data collection and analysis, or even with communication. Our story to this point is not one of being on top, but a story of maturing into adolescence or young adulthood. Our hope is that wherever you are in your program, our recent history would compel you to take your next steps. Maybe your next steps are behind ours, and you simply need to slow down in certain areas and be more strategic about the work you're doing. Maybe your program is light years ahead of ours, and that's okay too. Hopefully our recent steps inspire you to take your next step, whatever that next step may be. So here's what we've done. We now send a monthly newsletter to partners. You can see some snippets from that monthly newsletter on this slide. In those monthly newsletters, we list upcoming classes, and we have a standing invitation to all Safe Kids coordinators to come out and meet the people that are being trained in their areas. A lot of instructors and tech proxies, a list of instructors and tech proxies in each one of those emails, so that our key partners know where and by who the techs in our state can get their seats inspected for recertification purposes. There are many factors that go into helping our recertification numbers, but this is one of them. Our recertification rate for South Carolina went from around 44% in 2018, and it went up significantly to 51% in 2019. And we think that's part of the reason as we start focusing on keeping people a little bit more. The seat check data. So we have put this raw data into spreadsheets and also in the form of heat maps, which has thankfully spurred some healthy competition in parts of our state. We even had a manager contact our office to find out why several counties in their area were so low in numbers after my report found its way again to that manager's desk. I can't speak to what kind of conversations that manager may have initiated internally after talking to our office, but I can tell you that the evidence points towards a lot of positive growth for that coalition after our talk. And we think that's a good thing, just kind of bringing to light, what's going on and spurring improvement through that. One of the other interesting things that we did is we requested citation data for child restraint violations from our Department of Motor Vehicles. Those numbers were fascinating to me, as we found, among other things, that the county writing the most citations per miles driven was about 30 times more tickets than the county in our state that was writing the least number of tickets. In other words, there was a huge disparity in the number of tickets being written around our state. And so that's one of the things like we want to dig into a little bit more, and we hadn't found all the answers to that we won't quite yet. When we started sharing a list of our fitting stations with our partners, we also realized that we were missing a lot of folks who were already doing this work. Our total number of inspection stations in South Carolina has skyrocketed from 86 2 years ago to over 140 now. Of course, we're also sharing injury and fatality data and any other data that comes up that would be useful, such as major recalls. These are all things that we're sharing in our monthly newsletter. So we did a survey to our partners about these monthly newsletters recently, and first of all, about 92% of the respondents said they always or usually look at that newsletter, which was nice. And, who knows if those people are telling the truth or if they're just trying to make me feel good. But 92%, if that many people are actually looking at them, that makes me really happy. We have several recurring categories in these monthly emails. The two most popular recurring categories were upcoming calendar and a category that we call general reminders. General reminders is where we write a few lines to a paragraph each month talking about common issues that we see around the state. It could be something like not filling out forms correctly, not being aware of a technician code of conduct, or not consulting with owner's manuals as frequently and in a proper way as we should be. I was happy to see that that particular category, that general reminders category, was the second most favorite category when we polled and asked people what were their favorite categories to look at. So that was kind of fun too. Perhaps most encouraging is that 68% of respondents said that they used the monthly newsletter to actively improve their CPS program. So some quotes from some of our partners. Of course, we had a comment section, and here are some of the highlights. One of them was, I use the stats to keep my board members informed. The reminders help me with events and classes. Another person says, this is the only reliable data in our specific area where we can share with our coalition to guide us in making effective decisions. And then finally, I love the quality of the information and how it creates a sense of community. Good work on this. And I really loved each of those comments because it is exactly what we had in mind when we started this method of communication with our partners. All right, so improving coordination and transparency. So we wanted to bring Safe Kids coordinators together with new technicians. And so we're making an effort to introduce these people to each other. So after each class, our program sends an email to those new technicians and also to their Safe Kids coordinator, introducing them so they have each other's contact information and they know who they should be working with. We also added requirements to inspection stations in South Carolina that receive seats from our program. The first new requirement was that they had to start using the official seat check documentation. So in other words, they had to use the official Safe Kids form. And if they're not doing that, they don't get seats from our program. So we kind of were able to leverage that a little bit, and it helps out our Safe Kids coordinators and our state. All right, so improving data informed decisions. So I will say that we share pretty much everything that we have with our partners. If we think that there's a chance they might be able to use it to improve their local programs. This includes seat check data, that citation data that I was talking about earlier from DMV, and injury data. I told you guys I was going to circle back to Union County. Well, a representative from Safe Kids visited us in the spring of 2019 during a class in Union. After class, they shared their vision with us about how our program should go forward. One of the biggest things was that we need to get more strategic about who we trained, why we trained, and how we trained. We started using a host agency requirement document to ensure minimum class sizes, and that the groundwork for the class event had been laid in advance of our arrival on day one of class. We were even able to work with the South Carolina Department of Public Safety to tweak our grant deliverables to allow us to focus better on quality and longevity. It helped that because of this data that we already had available to ourselves, we already had a good handle on what our problems were, and we were able to effectively communicate those issues to our grantor. Because of these steps, the number of students in our classes has gone up significantly in this grant cycle, and frankly, we have used all of our new policies to reduce the number of classes that we do by strongly encouraging potential students to sign up for classes that are already listed on the schedule versus creating completely new classes. In a nutshell, we're making much better use of our time, and that data helped us do that. So what's in our future? The data does continue to speak to us. We feel like we're only scratching the surface. I kind of set that up several slides ago. We don't feel like we're a mature program yet, but we're working to get there. Some things that we are in the middle of implementing and some that are on the docket in the near future. Um, so first of all, we would like to create a shared database with all CPS activities going on, and basically we want to share that around the state. We think this will be especially helpful to our highway patrol, media liaisons, and the public at large. It's no surprise to know that the data is telling us we have huge deficiencies when it comes to bilingual technicians. So we're working on a plan to improve access to our services for Spanish-speaking peoples. Memorandum of agreements for fitting stations in our state. So basically, we want to encourage these agencies to not only offer this service, but to also promote the fact that they are offering this service, especially in more rural areas. Unfortunately, a lot of times this service is being offered and not taken advantage of, and so we want to start requiring some of those people that are partnering with us to do more of that push from their end. Pointing back to the citation data one more time, it's hard to say what the huge discrepancy in those citation numbers means, but without a doubt, we can use those numbers to leverage our way into some of these counties, both on the high end and on the low end with citation numbers. And then finally, we've already started working on this to a large degree, but we want to do a better job of marketing these inspection stations around our state. Currently, we have over 140 locations in South Carolina where parents and caregivers can get their seats checked, but the data is telling us that in many pockets of the state, either parents don't realize yet that this service exists, or they don't realize that this is a service they should be taking advantage of. And so once again, I'm Kevin Poore, and I'm from South Carolina and our Department of Health in South Carolina. You can see my contact information on the screen. I'd love to hear from anybody if they have questions, concerns, comments, and hey, especially suggestions. And so with that, I'm going to hand it over to Michelle.
Thank you, Kevin. Hi, my name is Michelle Sterling, and I work for St. Joseph Children's Wellness and Safety Center at our Children's Hospital here in Tampa. Our program here at our hospital has been running for 24 years under the coordination of the same employee. The reputation of that employee and the way she educates our community with excellence has been one of the huge factors that has helped to keep our child passenger safety program going. We've received funding from a variety of resources to keep our program going because the hospital does not fully fund our program, they just fund her staff hours. So in our department, we now have 12 child passenger safety technicians, 2 child passenger safety instructors, and 1 child passenger safety instructor candidate. We conduct car seat inspections throughout our county at a variety of locations and also at our office. In 2019, we educated 805 participants through our classes, and 274 seats were checked at inspection stations, and 493 seats were distributed through funding that we've received. I'm going to now go over some ways how you can get creative with having less and give you some CPS program funding source ideas. So one of them is community health needs assessment. Our hospital funded 1 car seat program coordinator as a community benefit. So I suggest that you reach out to your local hospital if you don't already know and find out if they have a community health needs assessment or something similar, and find out what their goals or their focus areas are for your community. Many times, to improve your community outreach, we want to see what is going on throughout our hospitals. And here in Hillsborough County, all of our hospitals got together and worked together on how we can benefit our community in a better way. Also, you can write letters to car seat manufacturers, AAA, USAA, GM, just to name a few. Those are places that we have reached out to ourselves. And a lot of times they will fund efforts like car seat inspections in order to help their community. Another idea is to check to see if your state has a governor's safety council or a children's services council that you can reach out to, because a lot of times they will have ideas that might be going on in your community that you're not aware of, or ideas of things that you can implement within your community. And lastly, reach out to local fire and police departments. Here in Hillsborough County, they don't do car seat inspections. We are the sole entity that do car seat inspections. So we are slowly beginning to train more and more of our police and our firemen. With our next child passenger safety class, which has been currently postponed, we are training 9 Tampa PD and 1 Temple Terrace Fire Department firemen. So as you can see, we are partnering more and more in order to provide safety more throughout our community than just our department. Next, contact your state's Department of Transportation. We began our program through Florida Department of Transportation, Safe Kids, and writing a grant to General Motors. You can research grant opportunities that could fund your car seat program and/or inspections. And we've also received grants from GM, Buckle Up for Life, Graco, and more. In our state, Florida, they have an Occupant Protection Resource Center, which they have free resources and giveaways on their site, including free car seats. So check to see if your state has a similar program. It's a great resource when you don't have much that you can use to spend on giveaways, flyers, and also free car seats if needed. Also, contact your local pediatrician offices, your local AAA, like I said earlier, law groups that want to focus on keeping families safe, to see if they would be willing to allow you space to conduct car seat inspections in their parking lots. It allows for the community to see what they have to offer if they're not already aware of their offices or locations of where they're located throughout your county. We have Children's Board of Hillsborough County here that receives funding from tax dollars. So the Children's Board funds our staff and car seats that we give out so we can conduct car seat safety classes. The participants watch a video. They do a test as a group, which allows the technician to go over what they've learned. They go over the car seat after it's handed out, and then they go to their vehicle to see, so the participant can put their seat in. Our technician visits with each family and vehicle to ensure the seat has been installed correctly, and the family does not have any other questions before they leave. So they have a criteria in order to make sure that they're eligible to receive those car seats. And one of the biggest things that I recommend if you do come up with a program like this is to have procedures in place so that the staff at the location you'll be using knows exactly who is eligible, how to sign them up, and any other questions that may come up. Our staff time is also funded by a local law group and a local pediatric office where we have free car seat inspections at their locations. And in turn, we give out a little flyer that has information as to where we're located, the reason why we're there, and how our time, we always go over with them how our time is funded through this office because they're passionate about what's going on in their community and they want to be able to keep their children safe. And with that being said, any other ideas that you might have or any other questions that you may have, feel free to reach out to me. I'd be happy to help you with some resources that we have available that I could send your way through email, or you can give me a call and I'd be happy to answer any of your questions. Now let me send it over to Kelly.
Thank you, Michelle, for that introduction. And also, thank you to both of you for all the great information you have shared today. You really have gotten a good idea on how important that data is as you're thinking about your program and what you need to be successful. And also looking at doing more with less. I mean, that's each one of us every single day. We have these great ideas, great visions, and oftentimes we don't have the support or the resources that we need to be successful. And when you're looking at the bottom line, which is number of children buckled up throughout the nation that are buckled up properly, all those are important. But one thing that is also important is succession planning. So when you're talking about your succession planning, you really need to have a roadmap, a sustainability plan. And really what that's going to do is allow you to kind of look at what you need in your community, in your county, in your city, in your state, whatever level you're looking at. It's that roadmap for making that long-term goal achievable. We want to make sure that we are choosing ideas that are going to work, that are definitely going to be sustainable, and that are going to move forward even when you are no longer there. So think about your roadmap and what that looks like. When you're putting together your roadmap and your plan, there's some things you need to think about. Who supports your efforts? Now, that's really important because many times we have students that come to our classes that are there representing an organization, but they don't always have the support of their superiors. And so maybe they've taken vacation time to come do this. Do you think that's going to be sustainable when they go back to work and try to do child passenger safety and check car seats during work time? So often that's the beginning of the failure. So we really recommend that you look at who supports your efforts. Is it your supervisor? Is it the department head? You need to continue to grow that relationship before you move forward in becoming a technician and making your plan for long-term sustainability. On top of that, you need to look at who are the people in your neighborhood. Who are your partners and the organizations that you work with every single day that can support your efforts? For example, in Palm Beach County, one of our biggest partners is Palm Beach County Fire Rescue. We're able to run 5 inspection stations a month, equaling over 25 hours a month. And we do that because it meets their needs in their organization too. So that also helps you determine what is your goal. When you're looking at your goal, you need to understand, is your goal to grow inspection stations? Is it to maintain just your own? Is it to create an online system that families can connect to find out where to get help, whether it's virtual or in person? Figure out what that goal is, and that will help you set that roadmap. Also, you got to look past right now. And that's what sometimes I find the hardest part is we get caught up in what's going on right now. And as you know, right now is very different. So what do you see your program and how do you see it running in 2 years, 5 years, 10 years? As you set that roadmap, it's going to ensure that even though you'll have some bumps on the road, you'll be able to stay where you need to. And you really need to question yourself in the beginning and all those you work with throughout. Why do you want to be a tech? What drives you to do this work? Again, that kind of sometimes goes back to who supports you. So if you get the people that are coming to your class, maybe you'll do a 20-person class and 10 of them are voluntold to be there and really do not want to be there and they don't see how it fits into their work. And you have 5 that are so excited to be there. They have the energy, they have the drive, and you have the staffing behind them that support them. They have programs in place to support them. That's fantastic. And then maybe the last 5 are those people that are just so interested in finding out, that are doing it on their own time, but don't necessarily have the support of their supervisors. Right there, you can start looking at what kind of success you're going to have from those 20 people. And how do you plan to make this successful? Always keep questioning yourself. Everything you decide on your plan, you need to question. It's like the why game. It's kind of like an onion, peeling it back. Why do you want to have a strong program in 10 years with 20 locations that can check car seats? Why? Because we have a large county with 1.5 million people. So having one inspection station won't meet the need. So why do you think 20 inspection stations will be able to meet the need? Well, because that will allow us to have one in approximately every municipality. And we can work with them on their schedules and times, and that will give people variety. And that way we can have people who are multilingual. So you kind of want to play the why game and the how you do your plan. Next, please. So it really starts with even putting a class together. If you're an instructor and you're putting your class together, why are you putting this class together? Is it because you have instructors who need teaching hours? Or maybe is it because your deliverables within your organization state that you'll teach a certain number of classes each year? Are you discussing who's the right student? Are you vetting your students or just filling seats? And that really is step 1. You need to be doing classes because you have interest in the community. If you do not have interest in the community and you are having classes just to meet instructor needs or just to meet a deliverable, again, can you see where you may fall off your plan? Invest your time in growing students before they ever get to the seat. That way, you know when they are sitting there, they have the investment internally within their organizations. They have the investment internally within themselves. And you are then able to keep your instructor team teaching hours up, and you're also meeting the deliverables at the same time. Another thing you need to really consider when you're putting that class together is, are you discussing the recertification requirements all the way from the beginning? How many times have you had students that call you the day of or within 24 hours of when their recertification is due? Now, we all know they get the notice way far in advance and that they are supposed to be responsible for that. But how often does that happen? And does it meet your schedule where you can jump at the last minute to help them out? So if you are discussing recertification from the beginning, almost like recertification is step one of your certification, you are setting that stage for them to understand that this is just the beginning of the work they need to do. So make sure you have a plan when you're putting a class together. Next, please. So this really kind of connects to why you want to make sure that you're talking about recertification from minute one. If you look at the recertification rates, the national recertification rate was 55.7% this year in 2019, and now the current rate has even dropped since that May, June 2019 CPS Express, and it was at 55.5. So as you know, certification sends out surveys, tries to find out what happens. And we know that a big portion of these are techs that just didn't recertify for multiple reasons. And one of those reasons is that they did not put enough time in their recertification process. Remember, recertification is not just going on and putting the information in. Recertification is the 2 years of work that's being done to maintain vital, maintain current, and maintain involved in your community. So again, when you're putting that class together, really hone in on what recertification is about. You should have those conversations before your students ever become students. This is all part of that vetting process to ensure that we are having a sustainable plan for our community for certification and child passenger safety. Next, please. So again, as I keep saying, you have to have a plan. And one part of knowing your plan, and Kevin was great and helped us with a lot of this information, was know your local facts and data. We all know what our community makeup looks like, and if we don't, we know now where to go to get help and how to get that information. But you need to know what your community looks like. What zip codes express extreme disparities in health outcomes? Number one, look at your health outcomes. Where are the disparities? Where can we make an impact? Do we want to just go into the best communities and just help everyone there and not even notice where those disparities are? No, because you're not meeting the needs of your community. Do you have a multicultural community with many different languages? Therefore, are you vetting techs that speak Spanish, Creole, Guatemalan, whatever, whatever your language is and your culture is? You need to make sure that you are marketing to those communities to get technicians to support them in there and educators. Those are the people that have the relationships that are going to make this work happen. You need to make sure that when you're working with your team, and it may be your team at your organization, or it may be your instructor team, if you are an instructor, you need to make sure you're communicating that plan. Everyone needs to be on the same page. Oftentimes, because the work we do is so very detailed and hard and hot and sweaty and exhausting and emotional, sometimes it's very easy for people to fall off just out of a disagreement. So be the cheerleader, keep everyone on the same page, communicate that you're all working together. Really look at your key players in changing outcomes. I highly recommend, again, before you even start in making your program, look at some community mapping. Where are the fire departments, police departments, community partners that serve children and families, hospitals, child care centers, and service organizations? Look at their missions. Does child passenger safety fit in their mission so that easily they could get the support they need from their departments and organizations? That's how we should be thinking. Not, thank you for coming to my class, but I don't know if you're the right person for my class. Here's the reason why. These are the type of organizations we need to be working with that make impact and change into your community. And I'm not saying ever to turn anyone away. I'm thinking this is how we should be thinking as we are putting together our program. You want to take time to meet with your partners, get their commitment. So now you're a tech and now you want to create this program, or now you become an instructor and you want to start teaching classes. Pull those reins back and really do your homework. Really look at what's going on with your partners and how to get their commitment. Because as you all know, many times one person leaves and now there's a gap. And so we want to fill those gaps and keep them from ever falling. Create formal agreements if possible. We do a MOU with our partners to ensure that they understand what we're asking of them. And this is even, again, before that car seat class. We want to make sure that their supervisors and their leadership is aware that we are going to be asking them to conduct a child passenger safety inspection station, or we're going to be asking them to ensure that their families that they are serving are getting the resources from that person they're sending from the class. I can tell you that if you vet through all of that initially, you will have a much better relationship long-term for years to come. And that will ensure that you are filling those seats with the right people. Next, please. So again, real quickly, you just want to kind of prepare for struggles and opportunities. We know it sounds really good on paper, but when you're out there, you're being pulled in a million different directions according to your position, and your team sometimes is doing the same. So be in constant communication with your team. Make it a priority to have those conversations weekly or monthly, or whatever you feel it needs to be according to the size of your community. Build your instructor team, and don't just leave it at that, but always be looking for that next instructor. We have come into situations where people have been doing it for so long that now no one knows how to do it, and as that person phases out, it's disruptive to the community, and that's not fair to the program. So always be looking for the next person, the next tech, the next instructor. Identify funding opportunities and have multiple funding sources. And I'm sure you've got a lot from what Michelle said, but we definitely have to have a variety of funding sources. Be prepared to provide that training and technical assistance. Again, once you train them, they should be in your email communication. You should be making plans to go visit with them. That should all be written up in your plan. Once you train them, you don't want to just leave them out there and then they contact you 2 years later to get recertified. Did you give them what they needed? Have they stayed connected? Are they technically on point? If you are going to invest in them, you need to invest in them for their entire child passenger safety career. That's part of what we do as leaders, as instructors in child passenger safety. Make sure you're providing opportunities to recertify. Share information about opportunities. Invite them to checkup events and other community events that you may be doing, presentations. Once you teach them, now they're kind of like your children and you want to continue to grow them. So again, this is why we say recertification starts before they ever get to the seat. In addition, prepare for a marketing and media plan. As you know, there are so many great times and through Safe Kids, there's so many great resources that you can use. But as those moments hit, you want to be ready to roll. If you've had things that have gone on in your community, you want to be able to discuss it and have everything ready to go, because as we all know, we're very busy. And also on top of that, with social media, plan ahead. Make sure that you're talking about child passenger safety and your current and local efforts right there. And also, don't forget to constantly meet new stakeholders. They are the ones that are going to bring the vitality to your program. Next, please. So again, remember, as I said in the beginning, passion versus planning. All of us get into this for whatever reason, but if we are sitting here today, it's because we have the passion. And sometimes our passion leads us and our planning tends to go to the background. So have a vision, create a mission, have really clear objectives, have strong strategies that look for those gaps and holes that we need to really address to be successful, and create your action. Next, please. And remember, once you train them, they become your children. And now they're going to be a part of your family forever. And so you're going to make sure that when you're training technicians, you're not just training them that day, but you're creating car seat programs. You're supporting their needs. You're providing assistance. You're being present, and you're showing up. You're showing that you can help them from the beginning, create their own plans to be successful with your support. And you will find that you will feel much stronger as an instructor, as the leader of your community for child passenger safety, because they become self-sufficient. And when they become self-sufficient, they start growing the program for you where it's less work on you. And remember also that those partnerships that you are creating now, they really can make a huge impact if you can get them to connect for a long term. And once those partnerships are long term, then you'll start seeing the numbers change in your community. So again, remember, I shared a lot. You've gotten a lot today from everyone. And really, I think the most important thing is succession planning is just always be looking ahead. I know we all get bogged down day to day with all the stuff that comes down the pike at us, and especially now with all the new changes. But keep an eye on the future. Think ahead. Be thinking about all the things that can affect our program and the outcomes, and try to adapt and recreate and reassess your plan as needed. And you will see that your child passenger safety program, even when you step out of it in 20 or 30 years, your program will continue to grow. I really appreciate everyone's time today. Here is my information. If there are questions or any resources I can help you with what I shared, I'd be more than happy. But good luck, and I look forward to watching the program grow in your community along as mine. Thank you.
Well, thank you, Kelly. Hopefully everybody learned something today. Thank you to Kevin, Michelle, and Kelly for taking the time to create these informative presentations. I appreciate everything that everybody presented today, and have a great day.